As part of our review of what happened in the COVID pandemic, it's very important to go back to statements that were made, reanalyze them, and try and explain where were the flaws. How were so many mistakes made in understanding the science? If there's one thing I've learned from the pandemic is that too much time was spent swinging the axe of treatment or interventions without spending enough time trying to sharpen the axe and understand the science as to what was happening with severe COVID. When we think about this statement about horse paste that came out from the FDA, which they eventually had to apologize about, you realize that the scientific community was locked into a narrative that instead of asking why something worked, they had a presumption as to what worked. And that was part of the reason why so many people died. Because if they actually listened to people like, say, Dr. Chetty, who wasn't getting deaths, they would have realized that maybe there are other ways. We'll come into this in just a moment. But just a reminder, in case you've missed this Heart Storm, Uncover the Secret Scars of the Heart, please look in the description below for all of the details as I break down this course with the question and answers. Lots of information here to help people understand a little bit more about what is going on with their heart. So let's get back to the question. And what caught my attention here was an X post or a Twitter post about something that Deborah Birx had said. She was the coronavirus task force lead under President Trump in the early part of the pandemic. And this clip was from Sense Receptor. I always give credit to who did it. And I'm going to play this video here very shortly. And in it, she was talking from 2022. So it's important to note the date. This is not in the recent few days. This has been in 2022 when she was making some statements when at that time the overwhelming narrative was that the drug that rhymes with pectin is actually horse paste. So listen to what she said, and I'll come back and explain a little bit more about the science in just a second.
And when I got pulled back for COVID, I was...
We'll start this over again. Just 1 second. I've got my sound switched off with this. I'm going to go again. So let's listen to what she had to say. Here we go.
And when I got pulled back for COVID, I was devastated to see what happened. Long before there was a vaccine, people were dying at higher rates.
Pause right there. Very important to deal with that first question. They didn't have testing in the rural parts of the United States, and she went and said something there. They did not have remdesivir. Oh my goodness. Talk about strange science. Because I did a whole presentation on this just recently. And it's important to note, and this is in the description as well. And you can look at this. This is how much money did they make from this drug. And it is an incredible story. Profit over patients, the remdesivir scandal, and the cost of corporate influence. Please take a look at this because this is fascinating information about the money trail and who profited. So in 2022, they were still talking about the fact that remdesivir was the be all and end all. But the reality is, when I did the presentation, and this one was actually quite difficult to do because the implications were so serious, I compared the use of remdesivir to what happened with the recovery trial and dexamethasone. This was what the data told us from 2020 that dexamethasone reduced deaths by 35% in ventilated patients. There was no question about mortality benefit. Comparatively, remdesivir only shortened hospital stays from 15 to 11 days, but did not reduce deaths. The WHO Solidarity trial showed no survival benefit. Yet this drug was used more across the United States than dexamethasone. Can you believe that? This is one of the worst bits of science, in my view, that ever came out of the pandemic. And so I'm highlighting that because in 2022, they're still talking about remdesivir. Did they not know it had no clear mortality benefit? Do you know how much money was made from this drug? When I added it up, it is, look at these numbers. This is what it made over the course of the pandemic. In 2020, they made 1.9 billion in just the fourth quarter, 5.6 billion in 2021, 3.9 billion in 2022, 2.2 billion in 2023, and 1.8 billion in 2024, almost 15 billion US dollars for a drug that it is known had no clear mortality benefit. Oh my goodness. This is what I mean when we talk about the failure of science. This is terrible. But let's listen to what else that she had to say. Let's hear of the other half of what she then had to say. Pause again right there. Can you believe she said that? There wasn't a doctor there, only a vet. So this is where the horse paste thing came up. Horse paste. You heard about that, and in effect, the FDA had to apologize eventually or take it down because they were denigrating one of our most important and probably one of the safest drugs across the world. One of the few drugs that can be used at population level safely. And they were making fun of it because they didn't understand the science. Now, the truth is that in order to understand the science around severe COVID, you still have to work at it. This is now 5 years down the line. I am still uncovering important aspects of the condition. And it's because I'm still looking, I'm trying to understand what is going on. And here is probably one of the most important points that I realized in terms of COVID fundamentals. There are three aspects to the disease: severe COVID, long COVID, and the COVID storm. All of them, it seems, are driven by macrophages. But what's really important about severe COVID is that this is primarily a disease going that severe COVID is a disease with manifestations in the lungs, but the primary driver of the cytokine storm is in the intestine. Very important point. And so this is why I'm saying if you then understand those factors and those important principles, it then helps you to understand why certain drugs that didn't seem to make sense were working. Instead, this is the thing about science. As I said, I am interested in outcomes. I'm not interested in credentials. I'm not interested in what you think should happen. I am saying if somebody was able to save patients' lives, I want to know how they did it. And my question is not that it can't work. My question is, how did it work? When I heard about Dr. Chetty with antihistamines, I immediately went back to the research to understand how in the world was he getting such good outcomes? And the answers were there. That's how science works. It doesn't work in reverse. So here's the final point that I want to make with regards to something very important about how this virus works. And it's taken from this paper here, which is SARS-CoV-2 replication in airway epithelia requires motile cilia and microvilli reprogramming. Probably one of the most important papers that I've come across. And there's a reason why this is such an important paper. I'm trying to see if I can get the image to be bigger. The reason it's so important is because when you look at how the virus infects, and this is what it showed, the virus, when it infects here, it goes down on the cilia, down into the cell. Notice these microvilli on the surface of the cell. This is in the upper airways. They are very small here. But once the virus infects the cells, because it can't get past the mucus, it makes these microvilli grow into trees, and then it's able to spread very avidly. In truth, this mechanism is likely to happen as well in the intestines. And guess what works on inhibiting this microvilli growth? The drug that rhymes with pectin. Similarly, with vitamin D and a number of other drugs and things impact on this. And anything that slows this process here is likely to have a long-term impact or medium-term impact on the spread of disease. This is the science. And so we need to look at what works, understand what works, and try and explain why it works. Not ignore it, not use terminology like horse paste. I mean, it just demonstrates people have no idea about the science. And again, as I said, at the time when I was looking for answers, if you had told me that you took paracetamol or acetaminophen and this was going to save lives, I wouldn't discount it, but I would go and look and understand how it could work. Because when you want solutions, you will find anything. It's only when there is an agenda, where there is something that is more important than even saving lives and finding innovative solutions, that you will bypass obvious pieces of innovation in place of a narrative. That needs to be fixed. And the biggest challenge today is to make sure that never happens again. So, as I do encourage you, please consider looking at the COVID Heartstorm. The link is in the description. And as well, I'll encourage you to look at the Profit Over Health, which is with regards to profit over patients on Substack. The link as well is there. And you should hopefully get a better understanding as to what happened in the pandemic. As we continue to dissect, keep up with me. Let's continue to look at the science and find solutions. Have a great evening.